And maybe it's not widely known, but this is a shadow family reunion today. I spent time with Matt and his cousin Allie, who works at the TwinWest, and his cousin Heidi at their cabin for, decades ago now. I'm not sure Matt recognized me today, but we've spent a lot of good time together. So the TwinWest is lucky to have the shadow family in full force here today. Thank you so much for that introduction, Matt, and thank you for having me here today. I know the power of this forum, and I'm really happy to be here today and answer, not only give a short presentation, but answer many of your questions that I assume you have. Before we go, I'd like to say thank you to a couple people. First, Gary Aiken from Tonka Financial. He is our sponsor here this morning and has been a great partner to Mnsure. He has been through our ups and downs with us and has persevered with us, and I think has helped us get the Broker Enrollment Center initiative off to a very strong start with us last year and again this year. So at the end of my remarks, we'll hear just a couple minutes from him, and then he will be available to answer some questions as well. The other person in the audience has my great respect, Brian Butner. He's way in the back. I see him. He was Mnsure's first board chair and preceded me in time, but really had the vision and perseverance to pull us out of some dark days that we had. And it is truly, he is largely responsible for that. So thank you, Brian. I think you are happy to be back in your civilian life now, which we call it, but really thank you, and I think your work is, we are all proud of it, and we all miss you every day. So my name is Allison O'Toole. I'm the CEO of Mnsure, Minnesota's health insurance exchange. It's an honor to speak with all of you today. I'm the daughter of two small business owners and grew up experiencing many of the things that you all deal with on a daily basis. So thank you for helping make Minnesota a great place to live and work. I started my career right out of college in the office of Attorney General Skip Humphrey, one of our great consumer protectors. I was part of the team at the AG's office who successfully sued the tobacco industry on behalf of the state. And I learned so much from Skip, one of them being the importance of fighting hard for consumers. From there, I went to law school, and for the next decade or so, I prosecuted some of the state's most violent criminals. As a prosecutor, you learn to think on your feet, think critically about difficult problems, and grow comfortable speaking in front of tough audiences. So don't get any ideas. And finally, before coming to Mnsure, I spent time in the private sector learning from and working with businesses and organizations and individuals on a number of complex issues. And about 18 months ago, that brought me to Mnsure. I came because I believe in Minnesota's way of providing health insurance coverage to everyone. It is, I'm going to use something that is cliche, but it's a state where our women are strong, the men are good looking, and our healthcare delivery is above average. And we've seen that again recently in 2 studies this week nationally that we are ranked among the highest in delivery and access and uninsured rate, and we should all be proud of that. But I think all Minnesotans deserve quality, affordable health insurance, and frankly, Mnsure needed some help. I know many of you in this room are seasoned insurance professionals who have been through our ups and downs, and we'll get to that in a minute, but first I want to thank you for your help, your thoughtfulness, and patience as we continue to grow and learn. It is your feedback that helps us improve. So for those of you not so familiar with Mnsure, let me start with just a few basics, and then we'll dive in a little bit more deeply. Mnsure is a marketplace where Minnesotans can shop and compare and enroll in health insurance coverage that meets their needs. We're the only place where consumers can qualify for financial help through either tax credits, which are like an instant discount off of premiums, or through either of Minnesota's public health insurance programs, medical assistance, which is our Medicaid program, or Minnesota Care. Mnsure helps dramatically increase the market transparency. And we provide a place where Minnesotans can do an apples-to-apples comparison of health plans from multiple carriers all in one place to make sure they're getting the right plan at the right price. And, you know, this is not as widely known, but we're a lot more than a website. We have a sister network across this state that consists of thousands of brokers and navigators who help Minnesotans enroll in insurance and demystify some of this process. We're a single front door for all of Minnesota's health insurance programs. Whether you qualify for medical assistance, Minnesota Care, or a private plan, Minnesotans fill out one application through Mnsure and can instantly find out what they're eligible for. I'll get back to that in a second as well. But big picture, oops, there was my map, my handy map here. But big picture, Mnsure was established by the Minnesota legislature in 2013 after the passage of the Affordable Care Act in 2010. As part of the ACA, states had the option of setting up their own insurance exchange or defaulting to the federal government, which is healthcare.gov. 17 states originally chose to operate their own exchanges, with Minnesota being one of them. But now there are just 13 state-based exchanges. We're still one. There are 4 federally supported marketplaces. There are 7 state partnership marketplaces and 27 states that use healthcare.gov. And that's just to keep it really confusing for everyone. But we are still among the 13 state marketplaces across the country. And in Minnesota, we also expanded Medicaid, our medical assistance program. We kept Minnesota Care, which is the nation's first basic health plan for the working poor, and created Mnsure for tax credits. And I have this map up because as a result of this work and the vision of policymakers in this state, we saw a dramatic reduction in our uninsured rate in just that first year. We saw a 40% reduction. We're about the 3rd lowest uninsured rate in the country, and that you see, I love this map because we are in the very light blue or white, right in the upper Midwest, leading the way on this charge, and we should all be proud of that. When more people have insurance, we are all better for it. But as you know, our road hasn't always been perfect. I came to Mnsure in the spring of 2014 under decidedly different circumstances. As nearly everyone knows, our rollout was far from perfect. That's our history, and we don't hide from it. In fact, we've learned quite a bit from that experience. And as those of you who have ever taken on transformative, multi-million-dollar technology projects already know, technology startups are hard, and that is probably the biggest understatement I will make this year. And quite frankly, Mnsure leadership at the time set expectations way too high. And I don't want to spend too much time focusing on those things because I can't change them, but you've all read about them in the business section now for years. But suffice it to say, we learned a number of valuable lessons, and that's where I want to focus some of my remarks today. Namely, Mnsure's credibility was in jeopardy with a lot of people: members of the press, lawmakers, brokers, navigators, other partner organizations, and most importantly, the public. That's why we took swift action. And I came in with about a month to go in the first open enrollment period, which is about February 2014. We hired staff to serve as liaisons to important stakeholder groups. We did a 180 on our advertising and marketing campaign. We listened carefully to our critics, no matter how hard that was. We listened before making changes. And we incorporated feedback into nearly every change we made. We also took some risks that are continuing to pay off at this time. If you're an insurance broker, you probably know we've now worked collaboratively with brokers to create the country's first broker enrollment center initiative. We saw the importance of partnering with trusted organizations and communities across Minnesota, like Gary at Tonka Financial and many others, and it worked. Both Mnsure and our broker enrollment centers saw a tremendous return on investment, and we expanded this program from 6 to 20 this year. We also added 4 broker enrollment centers for our SHOP program, which is our small business health options program. And I mentioned Gary's work with us, and he will maybe mention his work at the end of my remarks, but he is not only one of our broker enrollment centers for the individual market, but also for the small employer market. And he'll be joined maybe for a question or two by our salesman-in-chief, Bob Davey, who's right next to him from Mnsure, and answer any particular questions you may have. But back to our lessons learned. As a matter of practice, we solicit and incorporate feedback from stakeholders when it comes to making updates and IT improvements to our system. And Minnesotans are noticing a difference. Our enrollments are up year over year, and while we are by no means perfect yet, the feedback we get from the public and our stakeholder groups is encouraging, and encouraging that we're moving in the right direction. So some nuts and bolts about where we are right now. We're in the middle of our 3rd open enrollment period, and all eyes again are on us, especially from our legislative partners. We are off to a smooth and strong start. We're approaching our first deadline here. We have had more than 80,000 calls to our call center since November 1st. We have about a 2.5-minute wait time, which is better than many major corporations. And we have a little over 50,000 enrollees, and as of this morning, about 24,000 of those are in our private insurance, have private insurance plans. Our SHOP enrollment is up over 50% this year. So things are, we feel things turning around. I think some of this momentum is because we've had a really significant increase in insurance rates. Those rates are not something that I have anything to do with in terms of regulation, but that makes those tax credits more important for people, and that makes shopping around more important. We're seeing a lot more traffic. And I also want to make sure that I don't make the mistake that our first leader made in setting expectations too high. Things are looking good now. We are always cautious in our optimism, and you all will know all the way through this open enrollment period how things are going, but we are cautiously optimistic at this point. But that brings us a little bit more to today about the organization. We are an organization more committed to transparency and accountability than ever before, and I credit Brian Buettner for leading the charge on that. First and foremost, that means building and maintaining a system that works for the people in Minnesota. After 4 external evaluations, we have a governance structure that includes representatives from Mnsure, the Department of Human Services, and our counties that give input provided through our stakeholder groups. It means working collaboratively with brokers and navigators, counties, and our stakeholder groups to make sure we're listening and using feedback we're hearing from those of you in our community who use Mnsure. As many of you know, we've had long-standing stakeholder groups providing regular trainings and making webinars available as often as appropriate for stakeholders to not only learn from us, but so we can receive their feedback. It also means living within our means, and I put our a very high-level budget slide up here. We are, Mnsure's private plan business is run through premium withhold revenue that is off of every policy sold through Mnsure, meaning we get 3.5% of all premiums from plans that are sold through our site. We are revenue driven. That is not characteristic of other state agencies or state organizations. We have to have a balanced budget. We have that right now. We have a 3-year financial plan in place that is balanced. It is conservative, and just like all of you, revenues meet expenditures, and if they don't, we make hard decisions. This also means providing tools to promote marketplace transparency. New this year, we have a plan comparison tool that lets consumers compare plans based on actual utilization costs. In a year when premiums are rising so dramatically, this is particularly important. For decades, people have purchased insurance based on premium alone, and there's a lot more to it, as we all know. And this plan comparison tool not only incorporates premium, but also other costs, deductibles, co-insurance, co-pays, and other factors to give people a better idea of their true cost for insurance. This is a crucial piece of market transparency that helps make the complicated and often dreaded process of buying health insurance a little bit easier. So moving forward, in my view, as a leader of an organization in a new and evolving area, a laser focus on your mission, being open to evaluation, changing course when it's smart, and making sure you're being effective with taxpayer dollars is how we successfully move forward. As anyone who's worked in the healthcare industry in Minnesota, you'll likely hear everyone say, in Minnesota we do things differently, and I completely agree. This is a good thing for Minnesotans, and even in places like Minnesota where we do things better, there's change. And Mnsure's part of that change. You've heard me already mention the single front door concept where people come to one place, Mnsure, to obtain health insurance coverage. And it's hard to overestimate how important that is to the reduction in the uninsured rate. There's been a lot of discussion on the future of Mnsure, Minnesota's public programs, and our healthcare delivery systems during the last legislative session, but also in the healthcare financing task force right now, of which I am a member. These are important conversations because it takes really thorny issues that affect literally millions of Minnesotans out of any toxic partisan environment and into a place where experts in healthcare are able to talk about how we best serve the state. I've been spending nearly every Friday, I call it Task Force Friday, meeting with 28 other members of this task force as we attempt to solve these difficult issues. And we're nearing some decisions. It's important that we take these things seriously, and whether you're self-employed or run a small business, working for a large corporation, the health insurance marketplace touches all of us. And for some people, they're really struggling. Hopefully, moving forward, Mnsure will continue to level the playing field for consumers and clear the fog for Minnesotans of all stripes, young and old, rich and poor, urban and rural. We want them to have a marketplace they trust to help provide affordable, comprehensive health care. I appreciate your time this morning. I think what I'd like to do is have Bob Davey, our Mnsure salesman-in-chief, give a quick overview on the SHOP program, and then I think we have plenty of time for questions, and I'm happy to answer them to the best of my ability.
Real quickly, I think I've been to a lot of chamber meetings in my past, and one of the things that you don't get enough of is thank you. Your employees take pride in having a job. They take, and for those of you that are legislators, thank you for setting the rules, but they take pride in having a job and being able to support their families. So for what it's worth, I say thank you to all of you. What we also thank you for is when we started Mnsure, one of the things, and I hate to stand still, I'm kind of hyper.
Yeah, you're working on that.
Yeah, everybody who knows me knows I use a lot of caffeine to keep me going every day. Well, the reality is, we were firemen. As a little boy, I wanted to be a fireman, but I didn't know the day I started at Mnsure I was going to be carrying a hose all day. Well, when we got to put those hoses away, it got to be quite a thrill because we were able to focus on the things we meant to focus on, and that's relationships with the professionals that we needed to truly deliver what we had to the public, to the consumer, and that was the brokers. It was also the assisters who deal with the public programs. But the day I started, I was told you need to work with brokers. I did. I did what was unheard of. I picked up the phone and said hello. And I got an earful. I hung up. I picked up the phone again. I got another earful. I went home at night, and I said, it was a creative day for those calling me. I'd heard some things I hadn't heard before. So when I was able to turn around and go to those same people who were upset with us in the very beginning of the launch and say, look, I want to partner with you. Mnsure, we want your support. I can tell you that when we launched this pilot, Allison touched on it briefly, but we had a hard time getting 6 people to step up to the plate. And it was truly a pilot because we knew what we were getting into was an area that none of the states had gotten into before. Allison was an integral part of that. She oversaw the putting together of the program. She made sure that it clicked. She made sure that we got what we needed to make that program work. And as those 6 were developing it more and further and helping us get a platform so we could deliver this to the rest of the state, I have to say I took great pride in those 6 putting their businesses on the line with us. That group is now up to 20. This year, we had to turn people away. And that was sad, but something that we also sat back and said, it worked. It worked so well that we have states calling us from around the country asking us what we're doing and how we're doing it. They realized that we were the first state that really stepped up and said, we need to have this partnership with the professionals. And they're asking us, how are you doing it? What are you doing? In fact, we have a term. We created a special phone line, and Gary knows this line very well. It was called, and I was very excited about this because it just hit me, the bat phone. We have the bat phone. Everybody calls the bat phone that's a broker and needs help from this team. Last week, one of the other states who we've been helping put out a release that said they had a new bat phone. I went around going, oh, yeah, they get to say it first. But anyhow, it was really exciting to see they're copying us. And also, and if you don't mind, we're being looked at, with CMS is looking to us for healthcare.gov in our direction as well as to what we're doing and taking it to that next level, the rest of the country. So I take huge pride. One, okay, Brian's got enough accolades. Working with Allison is just huge because she actually helps us get things done. And that's why we're at today. And we're here with Gary, who, by the way, I cannot make this point strong enough. There are only 3 agencies in this state, 3 that are trained in on individual and shop. And you have a gem in this audience in Gary.
Well, as a broker in this partnership, I got to tell you, it's really turned from the year 1 of Mnsure. I remember going to one of the association meetings that were primarily attended by healthcare brokers, and everybody was in a quandary whether we're going to be in business again next year. A lot of healthcare people literally walked away from the healthcare market, especially the individual market, and segmented their business into the larger groups or to get away from the changes that they say brought on, okay? And there is some positivity in the ACA. You know, with all the other issues, there's a couple of things that happen. Everybody likes the idea that pre-existing conditions are gone. They like the idea that they can have more mobility in insurance. You don't have to depend on your employer. You could always have gotten it individually from the companies, but it's extremely hard to shop for. You had to go to one website, another website, talk to one representative from one carrier to another carrier, and they cannot compare each other's plans. And now you have an impartial service through Mnsure where you can actually shop for plans impartially. And you can get advice if you want to by talking to an independent agent, or you can talk to the carriers that are captive, and you can do that and make some decisions. But the fact is that people are able to shop for their insurance. And the real surprise that people come up to, a lot of people thought it was free. And it's not free. Car insurance hasn't been free, and we require that by law. We have a little bit more complicated vehicle to insure, though. This one's a multi-million-dollar vehicle. It costs a lot more to insure it and take care of it and maintain it. And see, once people understand the concept of insurance and explain to them, and they get that explanation by independent and captive brokers that understand insurance, they can get the right advice they need, and they get the reality check of what really healthcare costs and what it's about. and what you get for your dollars. And I think that's the important piece that this partnership has brought up, is that it's partnered with people that are experts in the industry. And that was not the fault of Mnsure that didn't happen at first. It's certainly not the fault of the current team. The current team has brought together and turned this around. And the biggest problem we have is getting the word out. And we need your help to do that. Because anywhere, if you're a business person and you have a choice, or an individual, where you have the prices are equal, doesn't matter where you get it. If you get the right price, or if you get two choices between a product, same price, one's got the possibility of assistance and tax credits and a safety net, whether you're a business or an individual, and one, that possibility doesn't exist, what way does it make sense to take it? Everything being equal, take the one where you got a better benefit. Most people, we have the biggest problem in this industry, I think, is that a lot of people, especially on the broker side, haven't realized, and for their own clients haven't realized, that Mnsure is an option they should partner with and they should help their clients. Because I have seen it, I've seen it on the business side, I've seen it on the individual side, where people could have been available for tax credits or some kind of assistance, and they've been denied because they were given the wrong advice. We need to get the idea that take a look at Mnsure. Take a look at it. It's free. You don't need to talk to anybody. You can go to the website. Yes, it's complicated. Some people say, I'm not going to go through that. It's too complicated. Well, then, call one of the partner brokers. We'll walk you right through it. If you don't want, call Mnsure. They'll walk you through it. Depends what you want. And I think that's the important piece. And what we want to do is open it up for questions and get people to understand this is a good thing. It's a revolution. It's happening in our state, and we're being recognized for it. But we're probably the best kept secret. You haven't heard the press about it. You hear a little bit of an editorial about this, that, the other thing. I mean, the fact that Allison O'Toole came from interim CEO to permanent CEO is probably the biggest news thing you've heard during this healthcare season. We've had huge healthcare increases. Many people had 50, 60, 40, 30% increases. It's like crickets. And it's really kind of concerning because we're seeing a lot of people that are just starting to procrastinate and get into this. They don't want to deal with it. Healthcare is complicated. It always has been. It'll never be simple because we're all individuals there. We all have different needs in your healthcare needs. And it's all based on our age now and pricing, which makes it very simple. If you're younger, you pay less. You're less of a healthcare risk. If you're older, you pay more because you need more healthcare services. With that, I'd like to open it up with questions so we can get some questions out there and some of your concerns out there and hopefully get a positive message out there that now is the time. Now, we have some deadlines before I open up questions. If you are a company with under 50 employees, you can qualify for the Mnsure SHOP program. That deadline to get in on open enrollment is this Tuesday, December 15th. Now, the problem there is that you get certain things waived, so it might be beneficial to put that program into your company. I'm not going to go into the details on the website. And that is getting to a deadline. If you need coverage for the individual side, by the first of the year, you have to get your application in and pick a plan by the same date, December 15th. Now, open enrollment for individuals is all to January 31st. As a company, the Mnsure SHOP program, your open enrollment is actually year-round. You just have the qualifications for the tax credits have to be met to get into the plan. Where you don't get the tax credits, but you can get the plan without meeting the 50% contribution and without having 75% participation rate that you normally have to have in group rates.
Okay. We're going to look for some questions here. Senator Han has one right off the bat.
Thank you. Thanks for being here this morning. Appreciate your work and your service to the state. And Allison, in your presentation, you mentioned there were about 49,000 enrollees. I know that most of the cost to get the exchange up and running has come from federal and state grants. What is the enrollment number that has to be brought into the system in order for it to be break even?
Thank you, Senator Hannon. Very good to see you this morning in this setting. I am sure I will see you soon in the halls of the Capitol. But very good question. So we have made quite public that our enrollment goals for this open enrollment period. We have a goal of 30,000 new enrollees, and then about 53,000 continuing, or people who will re-enroll, who are currently enrolled now, so a total of 83,000. We are seeing, and a couple things on that, we're seeing really good traffic right now. We're about over a third of the way to that new enrollment goal, which is good, especially right now as we're approaching this deadline. We're expecting a surge of activity in the next week or so. But the people who are enrolled right now, if they don't shop, they will be passively enrolled. We automatically re-enroll them. Insurance companies do the same thing. So we're expecting by the end of the month to have thousands of those folks have not shopped around. I hope they do, because I think they're gonna see a huge impact from these rates increases this year, but there will be thousands more enrolled by the end of the month just to get the people who currently have coverage through us will continue then. And that all of that is, on our website in case anyone wants to dig into that more, our budget and all of those documents.
Hi, any one of you can answer this. I have a friend who said stay away from Mnsure. Why would they say that? Their brokers have said stay away from Mnsure.
I'm sorry, what did, I couldn't hear.
Oh, I've had friends who say, my broker said stay away from Mnsure.
Oh.
So why would they say that?
Well, maybe I can let Gary answer that, but I would say don't stay away.
Yeah. This is the situation is that a lot of brokers may not understand Mnsure. They might be back, they remember the bad taste, and they have not come back since the first initial rollout. Remember when I first said there were a lot of healthcare folks that really thought that they were out of business, that this whole thing, the ACA, was meant to put them out of business. And they felt that the state of Minnesota, the way it was put together, they blamed Mnsure. Mnsure was the result of legislative, both nationally and locally, or in the state rules that were made. And I think now that with this new team that other brokers have not walked away, they don't understand the situation, they haven't been certified, they don't understand how it works, they haven't been trained. But the fact is that they're doing their clients a disservice. They're costing them money. Many times these people are going to be losing out on credits. They'll be losing out on better access to health care. They're going to be losing out on choice of plans. And quite frankly, most of the common problem is that they might be just tied to one carrier. It might be an economical reason for their own personal needs.
Thank you, everybody, for presenting today. My name's Adam Whitney. I work with Christensen Group. I'm part of the broker community like Gary. So I thank you for making your strides to improve things. But I guess I have two questions. One would be directed at the shop. To my understanding, there's still only 2 of the big 4 carriers that participate in the program. What, if anything, is being done to bring the other 2 back into the fold so brokers like myself can bring a client to one website for every carrier? I think that would be key for the broker community. And then secondly would be maybe more of a general insurance question for the state of Minnesota. Everybody hears about the huge increases in the individual market. What's being talked about behind the curtain to stem that? Because we've had 2 straight years of nearly 50% increases from the leading carrier in the individual market.
Good, thank you for those questions. First on SHOP, we did see 1 carrier drop out of that, and we will be active in recruiting those who have left to come back in to provide even more choice. So we have our eye on that. I think that's better for consumers when we have more choice. So we will do what we can. It is ultimately a business decision, that the carriers have to make, but I talk to the carriers every day, so I will do my best to get them back. I think it will help everyone. In terms of the increases in rates, so I mentioned that earlier, and it is really the Department of Commerce that is in charge of the rate review process, and we actually don't have a part in it. in that, you know, they set the rates, they review them, they negotiate. It is I think, quite a thorough process. But when they decide on the rates, we accept them and put them into our website. So we really don't have a role in setting or whatever. It is certainly on top of mind for everyone, and I think Commissioner Rothman is, and the rest of our policymakers are certainly watching that and probably will do whatever they can to make sure that doesn't continue to happen. But, you know, one thing I want to point out, too, when this is counterintuitive, when rates go up so much, that it really is important for people to shop around and do some comparing to see if that it will make tax credits more meaningful for people. And I think in this year, this is what we're seeing with the activity. You know, the volume that we're seeing is that more people are taking a more active role in this decision, and because of these rates increases, it requires that.
Hi, at this table, we were actually wondering the same thing that Senator Han asked about what is the break-even goal and sort of what is the overall enrollment goal. We were sort of struck by, candidly, the relatively low amount of enrollees that it looked like, you know, relative to the population of the state. Obviously, you're only starting year 3. What are the goals and when do you expect to meet them? And then to the question that Senator Han asked, when does that make Mnsure sort of a break-even proposition in terms of its own budget?
Yeah. Thank you. So we, you know, I mentioned the goals for this open enrollment period, and we are well on our way to meeting those goals. So I'm feeling again cautiously optimistic about that. We have a 3-year balanced financial plan in place right now. Our board will start work to expand that to the next 3 years in a month or so. So more coming on that. But I think, you know, we are at the other factor here that you may or may not know is that we have federal grant funding through the end of 2016. So that is really the point, you know, where we are needing to be sustainable on our own. We show that right now. We will project that further into the future in the next couple months with our budget work.
I'm going to ask another question here. There has been some discussion about being able to access those tax credits outside of the Mnsure exchange for businesses. Is there any progress on that, or can you talk to that a little bit?
I'm happy to, Deb. Thank you for that question. I get asked that a lot. And so the legislature last year directed the Department of Commerce to seek a waiver so that tax credits would be available outside, you know, through Mnsure, but then also off exchange. And they're really in charge of that waiver. We are providing technical assistance for them as they do that. But I think those waivers are due in 2017. So more to come on that.
You know, before the next question, I do want to point out on the shop, and it brought to my attention because we have 8 plans in Hennepin County under shop. 4 of those, though, I'd like to point out and thank one of our sponsors, Alina, who has put together a very competitive partnership with Blue Cross Blue Shield on the SHOP program. It is probably one of the best price plans out there, and if you, so I want to thank Alina for being a sponsor of this breakfast, but also being a sponsor and a partner in healthcare with Blue Cross Blue Shield, because it's a very competitive plan for you and your employees to take a look at. That they've done, and it's a great, great plan. So as a broker that looks at many, many plans, both individual and group, I want to thank you as another co-sponsor of being a great supporter.
Good morning. I've spoken to the Minnesota Department of Commerce with questions about the rising health care premiums and with questions about why they are going up so fast, especially Blue Cross. And I get the Colonel Klink approach. We know nothing, we see nothing, we hear nothing. If anybody remembers Hogan's Heroes. And I asked them where to go to ask questions about the rising health care costs. I have certain questions to ask, and they don't give me even a clue as to who to contact about that. Do you have any suggestions as to who to contact with inquiries about what are some of the reasons behind Blue Cross is reducing profits and the other companies reducing profits?
Well, who did you say you spoke to? Minnesota Department of Commerce Health Department. So why don't we Joe Campbell, who's here from our staff, will follow up with you afterwards. I think the Department of Commerce is certainly the first stop in that, but I want to make sure you're connected appropriately. I think, they are really, they did a series of public forums during this rate review this year. I think it's the first time they've done that. So that was a way to give input, but now it sounds like you're wanting to continue with that input, and why don't we'll help you navigate that if you have a minute afterwards. Hi, Senator.
Hello, and I do appreciate you being here, and I really appreciate the partnership with Gary, so thank you for that. We're hearing a lot about the move towards the high deductible plans and the bronze plans, and I'm concerned that when we talk about the importance of everyone being insured, we're really talking about that because we want to not have uncompensated care. But yet these, families who buy these very high deductibles can't afford the out-of-pocket costs. And so what percentage of your enrollees are doing that, and what can we do going forward to stop that?
Thank you, Senator. It's something that we've been asked a lot lately because we are seeing a high percentage of our current enrollees enrolling in bronze plans, which could indicate a problem. It depends on what that population looks like, and I think it's a little too soon to say through this open enrollment period what the impact of that is going to be. We are watching it closely because and that's also one of the reasons we put the plan comparison tool up to help consumers make a more informed decision, not just on premium alone. There are some, depending on the case though, there are some situations in which people get better coverage through a bronze plan too. So it's really quite an individual, when you're doing your side-to-side comparison, there may be some benefits to that too. But something we're watching, and I think that it goes to the bigger question of health literacy and helping people get a truer picture of the cost so they're not surprised down the road. But we'll continue to monitor it.
So maybe Gary can give a short answer. Gary.
That's a challenge.
We've heard a lot. Heard a lot about SHOP, and
Yeah.
so what is the big difference? But what is it exactly? I don't think a lot of people actually know what it is. So maybe you could share that. What's the big difference, and why would they even take a look at SHOP as opposed to having a group plan with Blue Cross through their company?
Well, SHOP is essentially an ability for a small employer to buy a group health plan for their employees at a very competitive price. And SHOP eligibility is 50 or under employees. If you want to get tax credits, you have to provide 50% of the cost, and you have to have 75% of the employees participate. The thing that's unique about SHOP, other than other group plans, is you pick a reference plan. And let's say that reference plan, 50% of the cost for your employees, and it varies by each employee, but the SHOP tool on the website, it's a macro embedded spreadsheet that will show you put their birth dates in, it tells their price, you pick a plan based on your budget, and you'll cover 50% of everybody's premium. Now, when you pick that reference plan, that 50% dollar amount, let's say it's $300. Okay, if I'm a younger person, I might pick a plan that may cost $400. You're going to pay $300 of that because that's your reference plan, 50% of your total cost. But for a young person, you're subsidizing me by 75%. So to younger employees, you look like a hero. But let's say I'm an older employee, you cover half of 50%, so my $400 is covered. But for my family, it's going to cost $800 for your plan that you reference. But I see another plan that I'd like to have. It's a platinum plan. Wow, I want a platinum plan. Now, platinum is the best plan there's out there. You can only get a platinum plan, by the way, on SHOP. No carrier offered platinum plans this year on the individual market, either on or off the exchange. So let's say I, because of my needs of my family, want to buy that through my employer. I can pay the difference of that $300, of the 50% of your reference plan, and if this plan costs me, say, $1,000, I can pay the difference that I would pay, so the employer's got a predictable cost, so I can buy up. No other platform gives the employees that much choice, or the owner. The owner can have a reference plan that could be middle of the road. Employees can choose down, they can go down, or they can go up between the choices. There's 2 choices of bronze and silver, gold and platinum, 2 of each in the current SHOP program. Does that answer your question?
Okay.
That would be one reason I would do it, besides the previous tax credits and all the other things.
All right, last question.
Allison, you had mentioned that there's a compensation arrangement between Mnsure and the carriers, is that correct? 3.5% of premium kicks back
yes,
to...
yes.
Is there a compensation arrangement between the brokers and Mnsure?
No.
Okay. Is there any incentive by the carriers represented through the brokers back to Mnsure?
No.
Any kickbacks or?
No.
I mean, it's certain volume. I'm just curious. It's very interesting, the dynamic here, that's all.
Mm-mm. No.
Okay.
I mean, I think, you know, those are good questions. And I look blank face because no, there aren't. So on the plans, you said it right. We get 3.5% of the premiums on the plans that are sold through our site. That is one of our revenue streams. The partnerships with the brokers, if they're individual brokers, just anyone who wants to sell, go through a certification process. They don't pay for that. We don't, you know, and then our broker enrollment centers, we have a special agreement with them where we lend very small amount of marketing dollars and some amped up technical assistance to them. We are in agreement, but there are no, you know, kickbacks or anything like that because of that.
Okay, and Gary has something to say about that.
Well, I think it's real clear how. Okay, compensation. Compensation's built into the premiums of all the health care you pay, wherever you go, however you buy it, it's all built in. So what we do is we get compensated on the plans that are not totally subsidized. That's how it works. So we do a lot of pro bono work. Over 50% of the people we help will not get paid for. But I'll tell you what, we make a lot of people happy, and it makes us happy when we go home at night feeling very, very good about our jobs. And I think every one of my team members at Tonka Financial thinks that's very personally rewarding too.